Does anyone remember when Gout made Malaysian headlines? It was 2021, if I'm not mistaken. Um, it was shoved into the spotlight actually by, I'm going to read it right here because what it says is it was shoved into the spotlight when former Deputy Prime Minister Datuk Sri Ahmad Zahid Hamidi's trial ended early as his defense lawyer was suffering from a gout attack. His lawyer was quoted by Malay Mail saying, "This is not a pre planned thing. Nobody knows if they're going to get gout. Gout is painful, and I'm under tremendous pain." Okay. But politics aside, right? The fact that this man had to quote unquote plead his case because he had gout, I think is very telling as to how much we don't know about what it's like to have gout, you know? So, on that note, I'm happy to welcome back Dr. Tan because we're going to have yet another conversation about gout because obviously we went through a lot of things in the first episode, but there are a lot more things that have not yet been discovered. And on this episode, what we really want to talk about is if you have gout, how do you live with it? How do you manage it short term? And more importantly, how do you manage it long term so that the quality of your life can remain in a place where you are happy? So, as a means to refresh our memory, right, Doc? Can you once again, in the simplest way possible, just explain to us what gout is again?
Yeah, so the last episode we talked about what is high uric acid. Yeah, so it could be no symptoms at all. That will be the first phase. That leading to the gout attack where you will have a painful joints. And then we are talking about and how we're going to diagnose whether you really have the gout or not. Right. Yeah. So that is basically about the first episode.
And I want to jump straight into the meat and potatoes of this episode, right? Which is starting out with short-term management of gout. Do you remember the last time you diagnosed someone with gout? And if you do you remember some of the suggestions or advice that you gave as their doctor as to how they should manage their gout in the short term?
So there is always this story when my patients come and see me, this kind of typical story that they will have a big feast the night before. Either there are some festivals that you're taking in a lot of a big feast. And then the next morning, early morning, they will be wake up by the pain. So the pain usually will be the area that we have mentioned, big toes, the midfoot or the ankles, that they are not even able to step down from their bed. So the joints will appear to be quite swollen, red, and even not able to touch it. Yeah. So that would be like the typical gout flare up that my patients describe to me. So when this pain come, I think the first thing that we have to do is to stop the pain. Right. So in most of the time, as a doctors, we'll prescribe something we call colchicines for the patients. So colchicines is a wonderful drugs. It's a very good drugs that we use to relieve the symptoms of the pain. But it's not like we want to cure the gout, but it's just for the pain relief. So besides the colchicines, there are other medications we use like the NSAIDs, like ibuprofen, or even we use corticosteroids.
And this is medication that is prescribed to them for them to take daily, or is it something that when the pain comes, take it, when the pain's not there, fall off the
Yes.
meds?
It is these medications is mostly for the pain relief. So you only take it when you're having the gout flares. And the gout flares usually will be they will peak about at the 12 to 24 hours. And some patients will last about 3 to 5 days. But within a week, usually it will just go away. Even without the painkiller medications. You see? So that is mainly the cause of it.
And are there non-medication remedies, at-home remedies that people can do if they're experiencing excruciating joint pain? So let me rephrase the question, right? As mentioned in the first episode and our conversation before this episode started, I know a lot of people with gout, and one of them being my dad. So I remember this one day, my dad had a gout attack. He couldn't follow us to dinner, right? And he had to lie down on the sofa at home. Conveniently, when his team was playing, Arsenal, conveniently the TV was on and he was there, and that's when he had the gout attack. Um, what could he have done, right, at that moment in time with excruciating joint pain? And let's pretend he couldn't get himself to a doctor immediately. What could he have done to manage that, immediately, so that he can get some relief before planning to go to the doctor?
Yeah, before you get the painkillers. Yeah, I fully understand the situation. I would advise to use something what we call a RICE method.
Okay. Rice.
Yeah, RICE.
Yeah, I like rice, yeah.
RICE. Yeah, like nasi is acronyms to indicate that actually for the R is to rest, I is for iced, and C is for compress, and the E is for elevate. Actually, it's a method we use for any soft tissue injury. So gout flare actually is an inflammation's injury to the joint. So you can also use this method to at least to reduce the pain.
And so you can use this rice method when where you have no means to go to a doctor at the moment, just to minimize the amount of pain that you're feeling. And then when you're ready and someone is there to help you get to the doctor, that's when you go see a doctor, and they may prescribe you with medication for longer term management.
Yeah, true. But nevertheless, there's a lot of patients where they're quite used to this flare up. They will store out the painkiller, you see.
Yeah. Yeah, that makes sense. So they're fully expecting
Yep.
for these flare-ups to come. So I think another thing that was mentioned in the first episode that I do want to bring back and remind our listeners is there are two types of gout, right? There's acute gout, and then there's chronic gout.
Yeah.
Is it always the case of it starts with acute gout and then it moves to chronic gout, or can there be no symptoms and then a sudden burst into chronic gout? How does it work?
Most of the time, the gout will happen in stages. Like we mentioned, from an asymptomatic, no symptoms, just high uric acid itself, it will move to the acute gout. And then you will have a few honeymoon kind of periods that you won't have any gout attack. But later...
It's also called intercritical gout, right?
Oh, you are right. Very good.
Yeah. Yeah.
Yes. Then after that, we will move on to the chronic gout stage where your attack will getting more and more frequent.
Right.
Yeah, and the pain will be not able to subside.
And then that's when something called toe-talpain also is relevant, or is
I
that
will
something completely
give you
different?
100 marks in your
Yeah.
bio exam. Yes.
That's right. Art student for the win.
Yes.
So I'm imagining once you get to the stage where you're experiencing toe-talpain and it's visible, it's a less than desirable state to be in,
Yeah,
obviously.
it's quite an irreversible stage there.
So what can someone do at the stage where they're experiencing toe-talpain? Is there anything that they can do to, you mentioned irreversible, but is there anything that they can do to minimize it as much as possible?
Yeah, we don't want to reach until the state of the chronic gout or even getting toe-talpain. So we want to reduce the uric acid level, okay, to back to the normal range, okay, as early as possible. That will be the end for the treatments.
And that's when like the change in diet comes in, the change in lifestyle comes in, more exercises. Do exercises actually help? I don't think we've mentioned this, but do exercises actually help with uric acid levels?
If you are the overweight patients, okay, an overweight patients actually make them more prone to having these high uric acid levels and the gouts. So by exercising and maintaining an ideal weight, yeah, that would definitely help.
Okay, cool. Noted. Noted for my future. I want to do something that I think will help our listeners better understand what we're talking about. And I think I'm gonna have to borrow some of the experiences that you've had, right, with managing gout patients. So we spoke about phases. Do you remember any experiences that you've had as a doctor treating gout patients from from the mildest phase all the way to chronic gout?
I do want to share a story about one of my patients. The first time I met him, he's about 27 years old. When he come just to do a blood test, just for his health screening, where we noted that actually he has a high uric acid level. So as usual, we'll advise him to you have to take care of your diet, you have to reduce your weight to come back to the ideal weight. So he was noted, then he left. Right. So I didn't see him for a few years, 1 or 2 years back. He came back to the clinic. At this time, he's having his first episode of the gout flare. So he's walking into the clinic with a slippers, obviously because he can't put his feet into a shoes. Yep. So it's in excruciating pain. He's actually in our ED, our emergency rooms there, waiting for us to give him a jab or a painkiller. That is how painful the pain it is. So I told him that this is actually a gout flare. And again, we advise him that you have to start to lose weight, to control your uric acid levels, to control your makan and all these things. Okay. And we see him back about a few months later. Another episode happened. So obviously he didn't really heed the advice that we have given to him. And then after that, we lost him to follow up. So the last time, the
As in,
latest
you
that-
followed up and then
no,
lost
he didn't
contact.
come to follow up anymore. So the last time I see him is about just recently, where that is about 2-3 years after the last time he came to follow up. And this time he come to us, okay, with the top-5. Then we can see there is already the top-5 that is appearing in his elbow, and very sadly to say that his kidney function has been affected too. So he has progressed from a very asymptomatic, no symptoms of uric acid levels, to the gout, the acute gout, and also to the chronic gout stage.
And
So
this-
it's
and this
very sad
happened-
we didn't get to prevent him to move into this chronic gout stage. And when I asked why you never come to us to seek for more treatments, then he is just answering that whenever he has the gout flare, he will just buy some painkiller and eat and continue with his life. And he's working as a tour guide, you see. So now, because the top-5 has been so bad, it has been on his toes and his ankles. He can't put his feet into the shoes, and he's not able to carry on his job as a tour guide.
And this all happened within the span of 3-4
About
years?
6-7 years.
Wow.
Yeah.
From
From the
asymptomatic
time
to
wave, yes. He's now like around 33, 34 years old. Yeah, still pretty young, you see.
Yeah, that's scary. That's scary to think that you think 7 years is a long time,
Yep.
but it's actually a blink of an eye. When you are past the 7 years and you look back, it's a very, very short amount of time. And to think that from the first time he saw you, it was it completely preventable?
Absolutely.
If
If he's
he had-
able to lower down his uric acid, okay, at the very first beginning, this is totally preventable.
So this brings me to something that I want to talk about, which is we've talked about short-term management of gout, but we also know that a lot of people go through all these phases of gout. Some listen to their doctors and some don't. But nevertheless, something I mentioned earlier is everybody deserves to have a way to manage their situation. And that's when the conversation of longer term management of gout comes into the picture. And this is something that I wanted to talk about with you, because the question that I have is, for people who are living with gout, is there good news as such that their lives can be comfortable again? Are there ways that they can manage their gout so that it never goes to a point where they have to suffer?
Absolutely. All right. Gout actually is very reversible, especially at the early stage. So just now we mentioned about talking in the short-term management is where you are having the gout flare that you want to have some painkiller to stop it. But a lot of people will just forget there and then. Like I say, after the pain has subsided, after a week, they're totally back to normal. They will brush away it and don't want to deal with it. But at this moment, actually, the aim should be to try to lower down your uric acid to the normal level. So that you won't get the flare and you won't develop into the chronic gout like what I mentioned to my patient just now.
Yeah, and are there professional treatments that can help with this? I think I heard something called a ULT or ALT, which is what does it stand
You have
for?
known a lot
ULT?
about these things.
Yeah,
Yes, Afiq.
I learned.
Yeah. So what we call this ULT is actually a uric lowering therapies. It's used for the gout, where we are giving the patients medications to lower down their uric acid. That is how the medications work in three ways. The first one is it want to increase the urea excretions by the kidney, and then it will want to decrease the body productions of the uric acid, and it also want to break down the urate. That is how it works. So overall, the aim is just want to bring down the uric acid level as much as possible to the normal level.
With a lot of treatments for illnesses, the medication and the treatments will help to contribute to you getting better, but there are responsibilities that you must take as the patient.
Yeah.
Which is
consistency is the
consistency
key.
is number one.
Yeah.
Number two, lifestyle changes that help lower uric acid levels in addition to urate lowering therapy.
Yeah, Afiq, you mentioned a very important point, which is the lifestyle modifications. That is really important in lowering the uric acid. Because as we mentioned in episode 1, right? So the lifestyles actually is one of the main contributors that why we are getting a high uric acid. Is all this like sometimes it's due to we are overeating some purine-rich food. So this purine-rich food I'm referring to will be things like red meat, right? Some fructose-rich drinks, okay? Seafood, and some soy-based products. That is what we call a purine-rich food about it. But it's not like you mentioned, a lot of my patients, when I talk to them about all these kind of foods, right, the first reactions is, so what is left for me to eat? Yeah. So this is really like, I would say that it's quite irrational for us to paste like a things in our fridge door to say that, oh, this is how many purines and this is the things that we should avoid. It is quite impractical, I would say. So what I would recommend to them is what we call a DASH diet.
A DASH diet.
Okay. So this diet actually is
Daman Sarasha Alam diet.
It's not really. Actually, this diet is first also designed for the high blood pressure patients.
Okay.
But this DASH diet initially, it means that it contains that you encourage patients to eat more vegetables, okay, to reduce the intake of the red meat. So you go for more fish, chicken rather than the red meat, and taking a lot of fibers like vegetables and fruits, and try to avoid the red meats and the fructose-rich things, the drinks. And this.
So do you avoid them or do you take them in moderation? Is it better
Moderation
to just avoid?
is the key.
Moderation is key.
Yeah.
So this reminds me of there's this thing about weight loss where like there's a picture of a plate and then it's like 20% vegetable or 20% protein. Is that something that works here?
Oh, I'm really surprised, Afiq. You know a lot about this diet. Yes,
well, I've tried going on a diet.
That is what we
100
call
times last year.
Yeah, that is what we call a suku sparrow. It's one of the things that Malaysia's government is promoting.
Yes.
To have
That's where I
a
remember it
healthy
from.
diet. Yeah, so this is actually, you can combine with your DASH diet. So when you are having a meals outside, like let's say you go for economic rice or you go for a mama store to have your meals, you can imagine your plate, okay, as a 4 quadrants.
Yes.
Yeah. So one of the quadrants is rice, and the 2 quadrants will be full of your greeny vegetables. Okay, and another quadrant should be the protein. So it could be a chicken. So to combine with the DASH diets, so your choice will be like chicken, fish, egg, sort of this rather than the red meat. Yeah.
So where it becomes difficult for me, right, this diagram, is it doesn't take into account how high I pile up the rice.
All right. Yeah, I see
So
your
it can
point.
be a single quadrant, but it's this high.
Yeah, I see your point. But usually, if you go for the economic rice, they will ask you you want the big bowl or the small bowl, right? Choose the small one.
Choose a small bowl?
Yep.
Okay. I will try. Is there anything else above and beyond urate lowering therapy that people can either consume or go through? Something like I think what was mentioned, it wasn't mentioned in this episode, but we did speak about it before, and that's where I remember it from, which is urinary alkalizers.
Yeah, that is true.
Yeah, what are urinary alkalizers?
Yep. So besides the medications, another very convenient way that we advise patients to take will be urinary alkalizer. This is a kind of the powder sachet form. where patients will just have to take it like 1 to 3 times a day, depends on their conditions. And actually, the flavor is quite nice. It's most of the time it is a lemon flavor. It's quite palatable. And how it works actually is because uric acid, it is very hard to dissolve when it's in the acidic backgrounds.
Right.
So if you alkalize the urine, there will be more uric acid to be able to dissolve in the urine and get flushed out. So usually I will advise the patient to take it together with their medications. So it helps with the clearance of the uric acid.
Mm-hmm. I want to mention something that's a bit more technical about ULT. That's written here, and then you can correct me if I'm wrong. But so it says ULT, urate lowering therapy, is typically recommended for those who have at least 2 gout flares within a year, or they have developed tophi, or they have radiographic damage attributable to gout. And then they also have severe chronic kidney disease, which is stage 3 or higher, right? And or have a serum urate concentration of more than 540 micromoles per liter. What is the normal measurement of that, if that question makes sense?
Afiq, you will definitely pass in my best medical students. Okay, so what you're reading actually is according to our Malaysia guideline on the gout management. It's like when we should start the medications. All right, so if that is good that we know something about it. All right, so if this person is having 2 flare of the gout in a year time, or where he's having already an evidence of this tophi, or in the that means in the X-ray that we can see there is already evidence of joint damage, or the uric acid level is high, which is like more than 540, that is about 25% higher than the normal level already. Yeah, so this would be the patients that we will consider we want to start the medications. But nevertheless, you have to discuss this with your doctor before you want to start the treatment.
Yeah. So because they'll know best, right, at what stage you are and what's going to be important for you.
Yeah, true.
Cool. We're going to take a quick break, but we'll come back for more exciting stuff about gout. So apart from ULT and urinary alkalizers, are there supplements that can help?
There are some research show that actually vitamin C do help, especially at the early stage of the disease. Yeah, so taking in some vitamin C might help about that. And there is some research also showing that eating cherry or drinking cherry concentration juice will help to reduce the flare out. But again, moderation is the key. So you don't want to be like eating 1 kg of cherry, just want to stop the gout flare of it. Yep.
And I think moderation with cherries are also important because cherries can also be a risk factor.
Yeah, so there is also that if you're taking too much of cherry, it might have become a risk factors for you to develop a kidney stones. So it must be careful about that
So
too.
it sounds like it's a double-edged sword. You just have to take it in moderation.
Yeah, moderation.
Question I have for you is based on like vitamin C, right, as a supplement to help. Not very few people know this, but I'm allergic to fruits. Right? I can't eat fruits, and obviously vitamin C comes from it comes from fruits most of the time. Does it mean that I am locked out of that, or do like actual vitamin C chewables tablets those also help, or must it come from eating fruits?
Oh yeah, I think if in your case that right, taking a vitamin tablets, vitamin C tablets will be the choice for you. So the studies actually that we have seen is also taking as a vitamin C tablets form or sachet form or in the supplement form rather than taking in the real fluid form.
Okay, great. That's great to hear. That helps me personally. I want to do a quick recap for our listeners, especially on what we've talked about so far. We've talked about short-term management, and in short-term management, there is a method called the RICE method in dealing with day-to-day battle with gout. RICE stands, if I remember correctly, RICE stands for rest, ice, compress, elevate.
Yeah, perfect.
100 marks?
Yes,
Yeah,
perfect.
thank you. So there's a RICE method, and then painkillers for short-term management. And then when you step into longer-term management, we're looking at treatments like ULT, which stands for urate lowering therapy, and then urinary alkalizers.
Yes.
And fun fact, for you guys, urinary alkalizers are actually available over the counter without prescription. So, whenever you need to stock up, you can go to your nearest pharmacy, get them there. But obviously, of course, make sure that you first of all see a doctor. This is not a one and done solution. And on top of that, just taking urinary alkalizers will not help. It will help to some extent, but you do need to ensure that you understand the responsibility that you have as the person who has gout to make lifestyle modifications, to make dietary changes.
Yeah, it goes hands in hand.
It goes hand in hand. They have to partner up because that's the one that will significantly help you reduce your uric acid levels. That will ultimately increase your quality of life when you are living with gout.
Yeah, so there is no single shortcut way by just taking medications or urinary alkalizer, but also a lifestyle.
You still have to do the hard work. The hard work still needs to be there, right? Because that's life, right? I think I've asked a lot of questions in this episode alone. And you've asked them tremendously. I can't thank you enough for helping me discover what it's like to have gout and how to manage gout. I do want to bring a question from one of our listeners as well. I'm going to read the question out, and then I'll ask you what you think about it. Okay? So this person who sent this in, they said, alternative treatments for gout really work. And I remember seeing some news articles a few years back where there was someone who was desperate to deal with his gout that he punctured what I assumed to be a toe-talpain. The blood just kept coming and coming, and it was brutal, right? So the question is this a legitimate alternative treatment, or are there other sorts of alternative treatment that works best?
It must be quite a scary moment for this listener, right? With the blood oozing out and out. So this is actually exactly why we are doing this podcast, that we want to send out the correct message and awareness to our listener. So that is wrong, okay, for you to poke into the toe-talpain because it can cause infections, bacterial secondary infections, bacterial infections.
And it becomes a whole different thing altogether now.
Yeah, exactly. Right. So, but if you're talking about poking in needles, but for chronic gout management, especially in pain management, okay, some traditional Chinese medicines like acupuncture do help. But of course, it's not poking the needles into the toe-talpain, but it do help with the pain control. Right. And others, alternative medicines, like we have mentioned, maybe like vitamin C supplements, and just now the fruits, cherries, they do help to the certain extent of it. Yeah.
So another question from a listener is, once they're on medication, right? Once they're on like urinary alkalizers, urate lowering therapy, do they have to take this for the entirety of their lifetime?
Oh, this is one of the commonest questions that my patients is going to ask me. Doctor, am I going to take this for lifetimes? I can understand that a lot of them are very afraid to taking the medications for very long term, right? So for gout, okay, we are usually, when the patient is entitled to have to start the medications, I'll monitor their uric acid level. Once they reach a desirable uric acid level, that will be about 360. All right, so they will have to go on with a periods of the times with the medications, and of course with the lifestyles modifications. I will try to slowly take off their medications. If they be able to lose weight, to control their diet, and there is no more gout flare, yes, you can be off.
Okay, so so it goes back to the whole, they come together.
Yes.
So once you use the medication and then you make the lifestyle modifications, and your lifestyle modifications are significant enough that it helps you reduce uric acid levels, then you can slowly get off the medication and you don't have to.
Absolutely.
Yeah. Cool. Thank you. Awesome. Thank you very much, Dr. Tan. I think you've answered way more questions than I thought. As we were talking, there was so many that was going on in my mind, so many questions that came up. And thank you so much for addressing them.
I'm glad
addressing
I
each of them.
Yeah.
So across the 2 episodes that we've had surrounding gout, right? The thing that stands out to me, and if there's anything that you guys take away from this, is that managing gout is a journey. There's nothing that's going to be a one-stop solution.
It's a lifetime
It's a lifetime journey. You have to get accustomed to it, and you have to make the changes that you need to make in order to have the quality of life that you want. And with the right tools and support, it's going to make it easier for you, especially in this day and age. So you don't have to worry about no longer having a comfortable life, or rather a comfortable active life. So make sure you get the right tools, make sure you get the right support, make sure to get the right diagnosis, go to the doctor, listen to the doctor. And bringing it back to that very scary story of your patient, I think early prevention is key.
Yeah, absolutely agree with it. So the early awareness, getting your blood test done to know that you are whether you are having a high uric acid level, and started from there.
Is there anything else after that you think our listeners need to know that we haven't touched on yet?
I think the key here is the awareness that you have to aware that uric acid is a serious health problems. Yeah, so and this is easily can be detected just by a simple blood test. So get your blood test done, know your uric acid level. If unfortunately you're already having a gout, deal with it. There are many medications that can help you to lower your uric acid level, and you can lead a normal life.
Awesome. Thank you for joining us, Dr. Tan.
Thank you, Afiq.
This podcast is a production of Renegade Radio with support from Abbott Malaysia. It was produced by senior producer Kelvin and producer Raghinie Ravi. Written by Alyssa, Pong, and Arnaldan Bryan Henry, who also edited the series. Fact-checked by the Abbott Medical Affairs team. And once again, I have been your host, Afiq Kamarudin. Catch you next time on the Vital Sign Podcast.